The 2008 recession was dubbed a He-Cession because the job losses were disproportionately in male-dominated sectors. During this crisis, however, it's been service sector jobs such as childcare, retail, and restaurants, which tend to have more female workers. With us now on whether this means we're facing a She-Cession and what to do about it, we're joined in Lethbridge, Alberta by Ken Boessenkool. He's an independent public policy economist and former advisor to Prime Minister Stephen Harper. And in the nation's capital, Armine Yalnizyan, economist and Atkinson Fellow on the future of workers. And Armine, it's good to see you again. You are a multi-time guest on this program. And Ken, I don't know how it's possible we've been on the air as long as we have and haven't had you on yet, but it's great to have you on finally for the first time. Nice to have you.
Good to be
Let us look at, I want to show a graph here. And for those who are listening on podcast, I guess I'll just describe this with a little bit more detail so you can see the difference between the past recessions and this one. And if we go back to 1981-82, this is Pierre Trudeau as Prime Minister. This is Bill Davis as Premier of Ontario. And you can see we've separated the jobs here into the red bars, which are the goods producing sector, and then the blue bars, which are the non-goods producing sectors. And the goods producing sectors obviously are much more damaging, much more devastating in terms of employment decline. Let's go to the next recession. This is 1990. Brian Mulroney, Bob Rae as Prime Minister and Premier. Again, significant losses in the goods producing sector, actually a bit of job creation in the non-goods producing sector. Then we go to the Great Recession, 2008, 2009. Dalton McGuinty is the Premier of Ontario, Stephen Harper, the Prime Minister of Canada, Ken's old boss. And again, we've got the goods producing sector with almost a 3-to-1. Well, you wouldn't want to call this an edge, but in terms of who's suffered the most. But then look at the numbers now. Look at the COVID-19 downturn, where we have just a dramatically worse, almost 4 times as many jobs lost in the non-goods producing sector as we do in the goods producing sector. So the obvious difference between this economic downturn and the previous ones is this one is being overwhelmingly felt in the non-goods producing sector, Armine, and therefore, what conclusion do we come to as a result of that?
Well, first of all, this is not like any other recession because it was not the result of a financial shock, a natural disaster as we normally see them, or any kind of end of a business cycle, where you do see goods production being the first thing that is hit, and consequently that's a male-dominated sector with better paid jobs. And in the immediate aftermath of every He-Cession since the Second World War, women have been the first part of the recovery, a she-covery, if you will, because men have got a higher reservation wage. They don't want to accept a crappy, lower-paid job in the service sector, but the women say, honey, we need groceries, and they go out and work, and they never come back even when their partner does get a job. I'm being very kind of stereotypical here, but that has been the pattern stereotypically. This time, we've got a service-led recession because we are trying to stop the economy to everything that is non-essential. And by the time we get to 2019, 71% of all GDP and 4 out of 5, 80% of all jobs is in the service sector. And the non-essential part of it, I mean, you'll notice in your chart, even the number of goods producing jobs were bigger than anything we've seen because we're stopping everything that is not essential. What will be fascinating is to see what is the path of the She-Cession back to she-covery, or will it be, as we have seen in the initial reopening weeks, a he-covery, literally turning our historic patterns on its head in terms of how we enter a downturn in the job market and how we recover from it. But frankly, I have to say, mathematically, it is impossible to get to pre-COVID levels without the girls getting their jobs back. And really, I can't see the path there from here at the moment.
Ken, if that's the case, then if you're responsible for making a public policy response to the She-Cession that we're in the midst of right now, what does that require?
Well, I think the other thing that's hugely different about this is that there's a public confidence issue here. A lot of people saying the government should open up the economy, the government should do this, the government should do that. But it's pretty clear when you look at the data that the service sector started declining long before governments did anything. And I believe the service sector, even if the governments start opening up the economy, will take a long time to recover because public confidence in physical interactions will take time to build. And I think people are going to be anxious and nervous. The polling tells us that. And so I think the first thing we should do is look at public confidence. There's a lot of my friends who are clamoring for the government to open things up. But I honestly think if the government opened everything up tomorrow, we wouldn't bounce back because it's public confidence. And so I think instilling public confidence that the pandemic is being dealt with and is addressed is probably the first and most difficult order of business. And then beyond that, I think the playbook for a male-led recession and a male-led recovery, every Department of Finance in Canada has that playbook. They invest in infrastructure. They invest in especially infrastructure. We don't have a playbook for a woman-led recovery, and so it's going to require, just as it required as we went into this, different kinds of thinking from different kinds of people. I think the departments of finance are going to be challenged to say this is not a normal recession. And it's not going to be a normal recovery, and it's going to require different kinds of thinking. And I think at the top of that list is issues around childcare, because childcare, not only is it going to be needed to get a lot of these women back in the labor force, but childcare also is going to be constrained by public confidence and physical distancing, ongoing physical distancing issues. So the supply of healthcare is going to be a challenge, and the demand for healthcare is going to be a challenge.
Armine, can we, at the very least, infer from Ken's comments then that if women aren't feeling economically secure going forward, the economy is going to have a devil of a time trying to come back?
It isn't just women feeling insecure about what's going forward. It's men and women being nervous about shopping, being nervous about sending their kids back into schools and childcare centers without very clear rules about physical distancing, and what happens if there's an outbreak again. Because, it's whenever you're in a close quarter thing is where you get the vectors of transmission, and childcare and schools are, by definition, close quarters. And like, if you've ever raised kids, you know how difficult it is to physically distance kids that haven't seen each other, particularly for 2 months. So
but let me jump in here for a second, Armine. Let me jump in with this.
We do have a devil of a, yeah.
Because the things that you just mentioned, and again, maybe I'll do the stereotyping here. The things you just mentioned tend to be things where women may have a greater say than the men over how much engagement there are on those things. So I wonder if it does get back to the original question, which is women have got to feel more secure about things going forward if we're economically going to come out of this thing.
That's okay. So you're right. It's a slightly different question than I was answering. And it is stereotypical in the sense that women generally are paid less than men. So if somebody's got to stay home to take care of the kids because the household doesn't feel like the school or the child care center is the best choice for that family, is more likely to be the lower paid worker. And then that is in itself a kind of virtuous, or like a terrible circle, where the lower the household income, the less money there is to pay for user fees for childcare. So families opt to not pay user fees for childcare because they're not using them, and then the childcare center can't stay open. So some measurable part of the ecosystem of childcare will be shut down because of this phenomenon, which means that there's nothing to go to or drop your kids off at, even if your jobs were to come up. But there's a second vector of problem here for the she-covery, which is a lot of the jobs that shut down during COVID that were deemed non-essential were marginal to begin with. Hair salons, nail parlors, yoga classes, some types of restaurants that were already operating very marginally. Anything in hospitality or accommodation that was on the edge is not going to do well on the other side, notwithstanding 75% wage subsidies and $40,000 lines of credit. If the volume of business is substantially lower, some of those places are going to shutter permanently. And that's where a lot of women work. And so, the malls, the retail malls are the last to open up for good reason. And that's where a lot of people work. So we don't know whether the jobs will be there and whether the childcare will be there if the jobs return. And those are both an infrastructure, a social infrastructure issue, as well as an economic, what's the economic landscape issue on the other side of COVID. And we don't know the answer to either of those things at the moment, though we could be preserving more jobs in the childcare sector.
Ken, you want to come in on that?
Yeah, I'm going to
Yeah,
layer
please.
something on top of that, which is, you know, we're already seeing universities make the decision to go digital in the fall, and we don't know about kids in school. So it's not just childcare, it's our schools may not come back very quickly. And certainly till the end of June, our schools aren't going to come back. Quebec's made noises like they were going to do it, and parents revolted, and I don't think many parents would have sent their kids to school if they would have opened. And so that's for sure until the end of June. And then we've got summer camps mostly have been canceled, and we don't know what's going to happen in September. And I like to use the term primary caregiver because most of them happen to be women, but I think it's the primary caregiver in families that is going to have the triple challenges of lack of childcare, difficult jobs to go back to, and school-age children at home. All three of those things are things we've never really experienced in a recession before.
Ken, I got a chart for this. Let me hold that thought because I'm going to want you to speak to this chart. This is perfect timing here. Tony Burke, who's directing today, do you want to bring this chart up? Thanks. Here we go. This is a chart which shows, and I'll describe it again for those listening on podcast who can't see the lines here. This is hours lost for family or personal reasons as a percentage of usual hours worked at the main job. And if we go to the bottom line first, there's the men, the red line at the bottom, which kind of just sort of ticks along at a fairly low rate and is a pretty straight line. But then if you go much higher to the blue line, which is the women, and that line goes up and down fairly regularly over the last 5-6 years. And then look at the hockey stick at the end. As soon as this pandemic hit, that line went through the roof. It basically illustrates, Ken, how, you know, even in this modern era where everybody's allegedly doing everything 50-50, it's women who are still losing 400% more time at work to deal with family or personal reasons. So again, I sort of interrupted you to show those numbers, but help us understand how that's going to have an impact as we try to figure our way out of this.
Yeah, like I said, it's the primary caregiver, which is most often women who are going to be struck by those three challenges that I just spoke about. And I think the graph just illustrates that. And I think just to move a step forward, we don't have the public policy tools well in hand to understand how to recover from this. I've written a few pieces in the last couple of weeks with some suggestions about how to move forward, but this is uncharted, like the whole thing itself, like the whole COVID recession itself. This is uncharted territory. We've not had this kind of a recession ever before, as you showed in your initial chart, and we certainly haven't had the kind of leaving work for personal reasons. I was at a grocery store the other day, and the manager walked up to the woman, of course, not of course, but the woman who was packing my groceries, and the manager just said, "If you know anyone that knows how to run these machines, can you please have them come in? We'll hire just about anyone." And I was like, "Well, what's the problem?" It's like, "Well, a third of our employees are staying home to watch their school-aged children, so they have work, but they can't go to work, right?" And so these are just like layer upon layer upon layer of challenges that we're facing going forward.
Armine, this next question for you comes under the category of please don't shoot the messenger. Okay, there are some people, for better or for worse, that believe that it's natural for women to stay home with their children and that this graph is a normal consequence of the way the world ought to work. What's your response to that?
It's normal when one of two partners makes a lot less money, and it doesn't make sense to keep the one that makes more money at home. So that's a normal economic decision. It's also normal that women are more nervous, by and large, about they undertake unpaid care for both elderly people, too old, too young, and too sick to work more often than men. That's what your chart showed. Whether that's socialization or something else, I don't know, but it's pretty typical. And what we have learned from economic studies is that the biggest difference between who makes how much in the workplace is not the occupation you have or even systemic pay rates at the get-go. It's the mommy effect. We've seen this even in countries as dramatically more egalitarian as Denmark and Sweden, that the minute a woman has a child, the man's income does not fall, but the woman's lifetime trajectory of earnings does fall. And the one way that you get actually more equality in pay is if the caregiving is more balanced between men and women. And we started to see that with some public policies at the federal level, which permitted parental care and paid time off for men as a rite of passage, which looks at the, at first blush as being not much of anything. But if you normalize men being able to take care of people too old, too young, and too sick to work, if that becomes a normal feature, then you get less of a wage gap. But it all comes back to who's making what. But that leads to a bigger question, which is we have normalized women who used to be told that if they're working for pin money. And now we have normalized that in any household with children, it is the most normal thing is that both parents are working and working full time. And now we've got a situation in which one of the parents isn't going to be working as much, and that is going to impede household income, and that will impede household spending. And household spending is the main driver of GDP. So we have got a real big problem, Houston.
Let me go through I was going to say what's ancient history now. It's not so ancient history, actually. We're going back about 15 years. Paul Martin was the prime minister. I think Ken Dryden was his minister responsible for signing childcare agreements with every province across the country. And it was I guess it was the first makings really in Canadian history of a national childcare program. The Harper Conservatives came in after that. They had a different view about childcare. They replaced it with a universal childcare benefit that was shall we say, different and smaller. Maybe that's the charitable way to put it.
Not smaller.
Ken, not smaller. Okay, Ken, that's why you're here. Come on in here and tell us whether we need the Martin vision, the Harper vision, or something new, given the times in which we're in.
Yeah, our country had a great debate in 2006. There was a lot of other things going on, but in 2006, we had a great debate about whether we wanted to have institutional based childcare, centralized and run out of Ottawa, building buildings for our children, or whether we wanted to give parents more money to make those decisions themselves. And at the end of the day, there's only so much money on the table. And the plan the Martin government put forward and actually started to implement across a number of provinces said we will give provinces money conditional on them building childcare. And the Harper government had a different vision. They said we should give parents money and let them choose. And that decision led to one of the greatest moments in that election campaign for me personally, because I was involved in writing that platform, which was someone named Scott Reed saying that this money would be spent on beer and popcorn. And that really turned the debate because people and Stephen Harper started saying, we've consulted the experts and their mom and dad. And so that debate ended. And then fast forward to the last election and Trudeau, rather than canceling all of those child benefits that Harper created over the years, rejigged them a bit, focused them a bit more on lower income, and didn't have a national childcare program. So from my perspective, we had a great debate on whether cash to parents is superior to the idea of the government's building and designing and building a childcare system. And the debate was won by the side that said cash to parents is a better way to go. And I continue to believe that. I've been saying in the last couple of weeks, there's ways we can enhance that in the childcare area. But that was a very important, very big debate that we had. And all parties, in fact, the NDP in the subsequent election campaigned on increasing benefits to families with children as opposed to a national childcare plan. So that debate was pretty soundly won, and we're on a path now where cash to parents is a very, very significant part of our social infrastructure.
Well, you're quite right. It was a big debate, and the Conservative side certainly won that. Mr. Harper won a majority government, but we are 15 years and one global pandemic later, and I just asked the question very neutrally. Armine, do we require a different response given the times in which we live?
The pandemic has really lifted the hood on what is essential about an economy. And part of what is essential is care, and good quality care. Care that is not hostage to the need to run a profit at the same time that you are delivering care. We've seen that in spades in the long-term care facilities. So people that are too old and too young to work need care if we're asking the working age population to lift them both up through their taxes that pay for the services for everybody. And going forward on the other side of the pandemic, we're going to have a smaller working age cohort as a share of the total population. In other words, fewer people lifting up more people with their work to be able to pay the taxes for the income distribution and redistribution, like the supports that Ken just talked about, as well as the actual care that is required in the service sector. They're paying for it all. And they can't do it if they're being asked to pay user fees that have got no limits and no quality controls on childcare. We are going to need every single child learning ready when they enter school, which they are not right now. We are going to need every single child living up to its maximum potential of skills development, preschool and during school. And we don't have such a system right now. It isn't about the central level of government designing and delivering programs. It's setting targets for a nation that is facing the pressures of population aging that COVID-19 poured accelerant on. We saw it in real time, what we are going to be facing for decades on the other side of this. And what we have seen is we need help with caring for the people that are too old, too young, and too sick. And that is high quality care that has got enforceable standards and uniform standards across the country, for which we are not paying user fees at the get-go, just like we don't with Medicare. We pay for it through taxes, but we don't pay for it on point of contact. Early learning and childcare has got to be considered part of the continuum of human skills development over the course of one's life, and needs to be part of the educational system. Having user fees attached to them for quality of care that, like, you can put as much money as you want in my pocket. I can't buy another high quality childcare space if it doesn't exist. I can only buy what's out there. And the more I pay, the less I have to spend on other things. We need to address this issue that more money in one pocket will simply come out of the other pocket unless we are putting into place quality controls and a basically guarantee of basic services that everybody needs, particularly the working age population who's trying to juggle working, paying taxes, and taking care of people that are too old and too young and too sick to work. That's just too much of a demand.
We got a couple of minutes left here, and I want to show two more charts because we're all about the charts here. This is the change in employment by people by age. And it may surprise our viewers to know that, and again, a little description for those listening, the people who are really feeling this the most are young men and young women, ages 15 to 24. They are suffering the job losses in the most significant way, and women more than men. And let's do one more here. This is a second graph that shows how many temporary workers have been laid off. And again, the line just sort of nudges along up until this pandemic and then literally shoots right up to the sky. This is people on temporary layoff in the thousands. And that rise is just meteoric. Now, Ken, in light of the facts reflected in those two charts, again, what does it call for in terms of a government response in this global pandemic?
I think the second chart is good news because people are still feeling a connection to their former job. And we talked off the top about manufacturing jobs that we can restart really quickly. And I think there's a bunch of those in that last chart that you showed. And if people still feel a connection to their former job, and if we can get those jobs back up and running, then I think that's a good news chart. The other one is pretty I mean, the people with the most flexible and difficult and early career jobs, the least attachment to their jobs are young people. So it's not entirely surprising. I think the difference between men and women that we're talking about earlier is more important than that graph. The young people have that's not that different than previous recessions, the age gaps, but I think the men and women are a big gap. Can I just quickly comment on something Armine said?
We got 30 seconds left. Go ahead.
The child benefits that Harper brought in and that Trudeau kept have done more to reduce child poverty in Canada than anything we've done for 40 years. And so I understand the desire to build childcare and have high quality childcare, but these child benefits have really made a material difference in the lives of many, many children in Canada.
This requires a follow-up conversation. We should get you two back. Armine Yalnizyan.
Can I say just one quick thing with that? I couldn't agree more with Ken Boessenkool about what the impact was on poverty, but no recovery without a she-covery, and no she-covery without childcare.
I agree.
I never thought I'd live long enough to hear Armine Yalnizyan say, I agree with Ken Boessenkool. So that made news today, if nothing else. Thanks a lot, you two. Good to have you on TVO tonight, and I hope we'll see you both again soon.
Great fun.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.